Hi, I'm Shane Lashley. I'm the Director of Lifestyle Medicine Programs for Westlake Medical Arts. And Dr. Lam has asked me to spend a few minutes talking to you about hair loss, especially female hair loss, and how we approach that from a functional medicine and nutritional point of view, and the things that we look at that may be driving that problem for the patients that come to me and to our practice. So we actually look at, when somebody walks in, we actually look at the bigger things than just the hair loss. A lot of times people will experience hair loss as a symptom of things that are going on in other parts of the body. It will just be the most alarming symptom that they may have noticed. But when someone walks in, especially a woman, and she says, I'm going through unwanted hair loss, I'm pulling things out in the shower, I'm pulling clumps out, it's in my brush, and I'm very uncomfortable with it, I don't like it. What can you do to help me with this? We generally start looking at things that are not related to the head necessarily, or obviously connected to the hair. We start looking at things that may be going on in other parts of the body that are shifting resources. What the body will do in many cases is it will shift the allocation of resources to solve other problems, and that sort of deprives the hair of what it needs to thrive. So you'll see nutrients moved, you'll see immune systems that are very activated, you'll see digestion that's really off, you'll see stress that's really high. So the body's fighting a lot of things in other places, and it's redeploying limited resources. So your typical, if you think about your body somewhat like a bank account, or like how you would manage your home bank account, you would think about it as you have income and you have expenses. So your income might be your job, but your expenses, of course, would be like the mortgage and the groceries. In your body's economy, your income is going to be your sleep, how you eat, the nutrients you consume, how you relax and let stress go out of your body, how you actually connect with other people, what you think about. Those are your income sides. That's what feeds your body. The expenses are going to be things like movement, even exercise, which is great. It's still an expense because it spends the resources. Stress, pace, lack of sleep, and all the things you do throughout the day, all the things you're going through. So a lot of times people have hair loss problems because they have a problem with the economy in the body. And that's what's really driving this. Now, there are people certainly that have genetic proclivities. They have a genetic leaning toward losing their hair. And so when they get these imbalances, that genetic expression will kick in, and that becomes one of the first things that starts to happen that they notice. But a lot of times, especially the women that I deal with, they're really going through a lot in their life. They may be stress adapted. They don't realize that they're stress adapted. And they're noticing that the hair is coming out in the shower, it's coming out in the brush, they're finding it all over their clothes, they're finding it in the bed, and it's very, very unsettling. They don't like what they see in the mirror, and they think it's really simply about hair. For the people that I've been able to help and work with, we find that it's often about more than just hair, and with this whole shift that's due to the body is fighting an immune issue. It might be stress, it might be high cortisol, which is your primary stress hormone. It might be that there's an underlying smoldering of the immune system that's going on, and that's very common. You'll see this in autoimmune diseases. There's about 105 autoimmune diseases right now that are classified as such, and roughly 1 in 4 Americans has an autoimmune disease. So you have a lot of people that really have a smoldering. Autoimmunity creates inflammation. So whether you have Hashimoto's or lupus or fibromyalgia, or there's a long list of other things that we could go through, all of these things have a constant inflammation, and it can be a low-grade inflammation. I call that a smoldering. That smoldering will have an immune cost to it. It's directing and consuming resources over to the immune system. Digestion's another area, especially women over 40, 50 years old. They start to change the acid composition of their stomach. And so, and their digestion and nutrient absorption can change. So you start to see people that aren't eating very well, they're not absorbing very well what they do eat, and then they're highly stressed, and then they're compensating for the stress. Well, you know, stress is an adrenal issue. It will throw out cortisol. Cortisol really is really hard on the brain. Your brain consumes around 20 to 25% of all your calories. So if you take a stressed person and they've got some inflammation, you raise their cortisol, you make the 20% calorie consuming body part really activated, and then you create a lot of anxiety, and then there's some low-grade inflammation. A lot of times people don't have the recovery habits, they don't have the nutritional habits to offset and disconnect from all those things. So imagine if all your bills tripled or quadrupled, but your income stayed the same. How would it work for you at home? A lot of times that's what's happening with someone's body when they have hair loss. So we can certainly treat the hair loss, and Dr. Lam does a fantastic job of doing that, but a lot of times we want to treat the environment that actually is driving the hair loss so that those investments are protected over time. A terrible thing to do would be to invest in hair loss and then restoration, and then have preserve all the things that made it go away. So it's a great idea to preserve the hair that you have, and to actually get the help you need from somebody like Dr. Lam, but to also think about the things that may have contributed to it beyond simply genetics, so that you can protect that investment. We use questionnaires, we use evaluations, we use all kinds of things that we can use to help assess where a person is and what's driving it, so that they can get relief. And as a result of that, they have greater hair, they have greater, stronger nails, but they also have a greater sense of peace, they breathe deeper, they feel better, they're more relaxed. And that's really the ultimate outcome, is not just how you look, but how you feel. You want to feel as good as you look, and that's really, at the end of the day, what we're going to work on doing. I'm not a doctor. I work for Dr. Eleanor Womack. I am a functional medicine and consultant in the lifestyle space. So feel free to check out Dr. Eleanor Womack at Westlake Medical Arts through Dr. Sam Lam here at Lam Facial Plastics. Thanks a lot.